My name is Dr. Stephen Davis. I own Green Hills Plastic Surgery, and I'm a board-certified plastic surgeon and have been board-certified for over 30 years. I'm a member of the Plastic Surgery Society, and I'm a member of the Aesthetic Society, and board-certified through the American Board of Medical Subspecialists, Plastic Surgery. Today I'd like to talk about veins. I'd like to talk about sclerotherapy, and I'd like to talk about varicose veins and incontinence. I'm a plastic surgeon. I've been doing vein surgery for 11 years. I was trained by a vascular surgeon over a period of 3 to 4 years, and this is a great operation. Typically, people with vein problems have burning, aching, throbbing, cramping, tenderness, heaviness, itching. They can have all or they can have some of those things. In many cases, the problem is that the valves inside the veins have failed. So what I typically tell patients is that we have two sets of veins. We've got one set of veins that are deep inside the muscle, and we have one set of veins that are underneath the skin in the fat. The veins inside the muscle we tend not to worry about, because when we walk and when we move and when we activate our muscle, it squeezes, and therefore that muscle squeezes the vein. So now the muscle is helping to milk and pump and push the blood for us. The muscles can generate pressures up to 300 millimeters of mercury. Our heart should be 120, so we can generate more pressure in our calf muscles and in our leg muscles than we can in our heart. So in the literature we refer to that as the calf muscle pump, or the second heart. In contrast to that, the veins in the fat under the skin are not a high pressure system, it's a very low pressure system. So I tell patients this is equivalent to the interstate and the highway. The muscle veins are like the interstate. The interstate's got lots of lanes and lots of speed. The muscles have lots of veins and lots of pressure. So because the interstate has more lanes and more speed, it moves more traffic. Because our muscles have more veins and more pressure, we move more blood. 90% of the blood that goes back to our heart is inside the muscle. In contrast to that, the veins underneath the skin don't have the push of the muscle, don't have the pressure, and don't have the large number of veins that the ones in the muscles do. Those veins and all our veins have little check valves in them that allow the blood to work its way up from the leg. If those veins fail, if those valves fail, then the blood goes up the leg and it falls back down the leg. The heart beats, it pushes it back up the leg, and it falls back down the leg. Over time, those veins start stretching and swelling, and blood pools, and the blood does not necessarily move up the leg. As a result, the veins start bulging and you get varicose veins. Now you can get some of that blood sitting and becoming stagnant. The pH changes, it becomes a little acidic, it becomes irritating, and therefore aching, burning, throbbing, cramping, tenderness, heaviness, itching, restlessness, or all of those things. So the first thing we need is a roadmap. So we're going to ultrasound the legs. We're going to look at the deep system or the interstate. We're going to look at the superficial system or the highway. And if you've got a bad highway and your deep system is working well, your muscle system is working well, then we can just simply close the highway and redirect the flow to the interstate. It's a very nice operation. It works very well. Complication rates approach 0. You walk in, you walk out. The next day is essentially a regular day. We've never written for narcotics or pain pills for patients, and patients do very nicely. The other piece of this is the next level up, which is spider veins, reticular veins. These are the veins that women and men want to not have visible on their legs, and so therefore they get sclerotherapy. Here's the problem. If the veins in the tissue underneath are bad, if the valves have failed, now those veins are congested, they're filled, they don't have a lot of pressure to move blood, and the body is always attempting to move blood back to the heart. So the spider veins, the reticular veins, and those sort of things in a large percentage of the cases are related to the fact that the superficial veins in the fat have failed? The answer is not sclerotherapy, because they'll return because the pressure is below. The answer is you fix the veins underneath. You fix the incompetent veins, the varicosities first. You close those and redirect the flow to the deep system. Now, the superficial veins, the spider veins, the reticular veins, now you can do sclerotherapy, and it's much more effective because you've eliminated the failed pressure source from below. I hope that gives you a better idea of incompetence in veins. It gives you a better understanding of sclerotherapy, spider veins, and reticular veins. Please feel free to contact us at any time. We'll be happy to discuss this with you at Green Hills Plastic Surgery.